A very warm welcome and good evening, everyone. I'm Arushi Negi and I warmly welcome you all to the Udaan New Heights with Knowledge flight by the student for the student NORCET Webinar Series, which is a special initiative by Nursing Next Live. Today's topic is From Storage to Shot, Mastering Cold Chain and Vaccination. This is an extremely important topic, not only for UG nursing students, but also for NORCET aspirants, as it plays a vital role in clinical practice as well as exam preparation. So get ready for clinical clarity combined with exam-oriented insights. The vision of the Udaan series is to give every nursing learner the wings of knowledge, so that they are not just exam ready, but also concept strong, confident, and future ready healthcare professionals. Our aim is to make learning accessible, friendly, and inspiring so that every student can uplift their journey and move forward and stronger knowledge and confidence. So let me take you through my next slide. I hope you all are able to see my screen. Okay. So talking about NNL1, it is a pioneering nursing edtech platform that was launched with one mission to provide high quality, accessible, anytime, anywhere nursing education. Since 2020, NNL1 has built complete learning ecosystem from learners from UG to MSc Nursing, NCLEX, and especially NORCET, aligned with the latest INC syllabus and created by India's top medical and nursing experts. Along with online learning, NNL1 is now leading in offline education as well, with centers like NNL Academy Noida, NNL EduHub Jaipur, and NNL Bangalore coming soon, which offers CBT labs, simulation-based clinical training, in-person sessions, certifications, and doubt clearing programs. So far, Nursing Next Live has helped more than 7,500 nursing aspirants achieve success in national level exams such as NORCET, ESIC, RRB, and state PSC. So as you can see on my screen, so why NNL1 is students' first choice? NNL1 is the top choice among students because it brings together top educators, high quality content, and continuously updated study material in one platform. As you can see, with structured tests, guided study plans, and an engaging learning experience, students become truly exam ready with 7,500 plus selection, a trusted by toppers approach, a strong mentorship. NNL1 has become one of India's most reliable and result-oriented nursing learning platforms. So let's now move forward to our itinerary for today. As you can see, we have done the welcome session. Then we have covered the introduction of NNL. We will be talking about the special reward as well as the introduction of speakers. Then we will be moving towards today's topic, cold chain and vaccination. We will be hearing from our NORCET rank holder, as well as we will be going through certain plan details. And there will be a Q&A round towards the end with the closing remarks and special rewards. So I hope you all are ready for today's session. So let me tell you about the special reward book. For all the participants who are going to stay with us till the end of webinar, we have a special reward for you. You stand a chance to win the Masterstroke Volume 3 book packed with high-yield one-liners, last-minute revision points, and exam-oriented concepts. So don't miss this opportunity and stay with us till the end. Today, we have two distinguished speakers with us. First, I'm going to share about Mr. Mutthukumaran, who is our Mastermind faculty. Mr. Mutthukumaran, MSc Nursing, NAP, CAIM, is a content strategist, nurse educator, and NORCET coach with extensive research in nursing education, clinical practice, and research. A former senior research nurse at JIPMER, Puducherry, he has contributed to advanced healthcare, research, and patient care initiatives. He holds a certification in palliative care and integrative medicine from NAPChem Lucknow and is a BLS provider accredited by American Heart Association. As the patent holder of Oxymore, he demonstrates a commitment to healthcare innovation and practical solutions. With expertise in curriculum design, exam preparation, content strategies, and professional mentorship, he has guided numerous nursing students to success in competitive exams like NORCET while fostering a supportive and engaging learning environment. We welcome you, sir. Next, we will be hearing from Mr. Dominic Maximillion, who is our proud rank holder With in the NORCET 9, he has secured rank 23. He has completed his BSc Nursing in the year 2021 to 2025 from Madurai Medical College, Tamil Nadu, and has been currently allotted AIIMS Mangalagiri in the NORCET 9. We welcome you, Mr. Dominic. So as we move forward towards today's session, let me share a few guidelines for today. So first, the speakers will be presenting one by one. Participants can post their question in the Q&A box during the session, and all questions will be addressed in the final Q&A round. Please stay till the end for special rewards. So with this, I share this session with Mr. Mutthukumaran, sir. Over to you, sir. Sir, if it is taking a while, please let me know. Okay, I think it is taking a while. Why don't I invite Mr. Dominic, our proud rank holder, to share his vision on the topic. So, Dominic, I hope you are able to hear me.
Yes, ma'am, I am able to hear you.
Okay, so congratulations once again on your achievement. And could you please share how to prepare questions related to cold chain and vaccination in NORCET? And also, what advice would you like to give for future NORCET aspirants? So over to
Okay.
you, Mr. Dominic. And I would like to share, I would like to ask you to open your camera as well. Okay, now we are able
Okay.
to see you and welcome. And please give some guidance related to the topic and also for the NORCET. Please.
Thank you. Good evening, everybody. First of all, cold chain is an important topic. And the most common mistake everybody make is we will refer to many resources. That is the most common mistake because in market there are many resources, and in every resources their content is different, varying from one another. I suggest you to follow NNL content because I prefer it. It was very genuinely correct and it has no incorrect stuff. Okay. Then I tried. Then I will tell everybody to study the cold chain from the community subject and the pediatric subject as a whole. So you don't mix up here and there. So don't study separately for pediatrics and community. You study as a whole, okay, including the programs and including the cold chain, etc. In cold chain, one of the important things is which are heat sensitive and cold sensitive. This is very important topic, and you want to study it in either in an ascending order or descending order. You don't want to study both. You just want to study either ascending or descending order. And there are light sensitive vaccines as well. Okay. Then another important topic in this cold chain is ice lined refrigerator. We want to know what vaccines are placed in the bottom, what vaccines are placed in the in between, and what vaccines are present in the top. And we want to know what temperature it is maintained. And we should know that no vaccines are kept in the freezer. And like then another important topic, which is the third important topic, is vaccine vial monitor. This is also very important. They will ask picture related contents in this topic. Like they will give they will give the picture and they will ask whether we can use this vaccine or not. Okay, and there are some vaccines which are coming under vaccine vial monitor, and some vaccines will not come under vaccine vial monitor. Then another important test in cold chain is shake test. This is also we want to know. Then apart from cold chain, we want to know which injection is intradermal, which injection is subcutaneous, which injection is intramuscular, and in which injection is giving in which side. Some vaccines are given in left arm, some vaccines are given in right arm, some vaccines are given in thigh, right and left thigh, like that. Then before studying every indication, you need to study the contraindication. That's very important. Then in contraindication, the few points will be confusing. Like there will be relative contraindication, like that is not absolutely contraindication, like fever, mild sore throat, diarrhea. This will be not absolutely contraindication, but there will be absolutely contraindication like epilepsy for some vaccines. So contraindications is important. Then apart from contraindication, you should know that some of the side effects which are occurring after vaccination, like contraindications and side effects are completely different. So you need to study that both separately. And apart from that, open vial policy is also important. Open vial policies is actually came before, but nowadays it gets updated. So you want to know the updated content as well. So in this cold chain topic, what is important, right? You want to know the details up to today's topic, because every day the content is getting updated. So be updated with us. That's all. Yeah.
Thank you so much, Dominic. I think you have highlighted all the topics that are very important for the from NORCET point of view, and I think we are going to cover a lot of these topics today also. So thank you so much for guiding us and all our participants today. And now I would like to ask Mr. Mutthukumaran sir to share his screen, please.
I think my screen is visible, right?
Yes, so we are able to see your
Yes.
screen as well, and you. Thank you.
Yes. I am very happy to present this topic in front of you all people. So thank you for the good introduction. I feel privileged to be present here. Thank you, Arushi, for organizing this. Straightly, we are going to the topic. So why immunization and cold chain is very important? As Dominic said, lot of current trends and analysis. Every year, starting from NORCET, previously AIMS were conducting the individual examinations also. Vaccination plays a vital role where you will be getting 1 or 2 questions minimum. It is a high-yield topic. You should learn the topic before going for the exam, which plays a important role. Shall we move on to the topic? Yes. Are you all ready? Shall we? So in this session, what we are going to discuss, the importance of cold chain.
I think there's a technical issue. We'll just wait for that, and then we'll be able to start the session again. I hope you all are excited. You need to respond in the chat box, in the Q&A box, so that we can see that you are actually in the session. And this session is important to you, so please respond whenever sir is asking you any questions or in between. Please respond accordingly.
Yes. Yes, sorry for the inconvenience. Yes, now everything is set. We are starting the session. Get set, go. Yes. What is this cold chain? As I want to congratulate Mr. Dominic, who have secured All India ranking 10, that is 23rd rank All India, that is in 2025 in the NORCET 9. Congratulations, Dominic, and he is working as a nursing officer in AIMS Madurai. That is very happy to hear, and he is our student Plan C Plus subscriber. Yes. So coming on to the topic, what is this cold chain? Cold chain is the important aspect that the optimum temperature what we are going to maintain as per the guidelines given by the manufacturer. So each and every state, like India, we can say as a country, we are following on guidelines. As per WHO, we are following on guidelines. This session, we are going to discuss about both the things, what India is specially we are following, which is happening around us, especially which storage system which we are following in our primary health center, as well as in our regional centers, where regional centers will transport the vaccines to 4 to 5 districts, like Yes. So the system used to maintain the vaccines within the recommended temperature to maintain the potency of the vaccine. So what is the purpose? Obviously, to ensure the vaccine potency and effectiveness. So what we are going to give, why we are going to give vaccination? Now tell me, which level of prevention is vaccination? Which level of prevention is vaccination? Yes, primary prevention. So when we talk about primary prevention, we are having health promotion and specific protection. It comes under which? Whether it is specific protection or health promotion. Yes, Ekita Rajbud, you are correct. You are correct. Bhaskar Chaudhary, you are correct. Yes, Neha Mayur, Hemana. Yes, specific protection. Yes, good. We are on the track. Yes, it is a specific protection. Why we are telling it as specific protection? Particularly, we are targeting this type of conditions and we are preventing. Okay, the chain of transmission is being prevented there. Even though the causative organism is there, but we are getting immunized. We are getting the society and community to be get immunized. Okay. The second point is prevent vaccine wastage due to exposure to heat, light, and freezing. So from this point, we are getting that there is heat sensitive vaccine, there are light sensitive vaccine, there are freeze sensitive vaccine. The heat sensitive vaccine, which how much temperature we are going to make? Like freeze sensitive vaccine, the optimum temperature is ideally we are keeping it at 2 to 8 degrees Celsius. That is for heat sensitive vaccine. What for freeze sensitive vaccine? Freeze sensitive also will be like 2 to 8 degree. When we talk about heat sensitive specifically, it should be less than 2. That only one vaccine which we are having to, that is heat sensitive vaccine, that is OPV, oral polio vaccine. The optimum temperature has to be maintained as per Indian guidelines, that is -20 to -25 degrees Celsius. Below that also we can keep, that is till -15 degrees Celsius, and below also we can keep. This is the optimum temperature for OPV. Okay, yes. Now when we talk about cold chain, all vaccines and all methods are there. There are methods of cold chain which we are going to make. That is, we are having methods and equipment. Like we are having active cooling method, passive cooling method, monitoring method, and reverse cold chain. Sir, what is this active cooling method? Active cooling method will work on electricity basis, like refrigerators which we are using, right? Large ILRs and large refrigerators which we are using. Okay, like 20 liters, 40 liters ILRs, which we are deep freezers, which we are using with the active cooling method. What are the examples? Walk-in coolers, walk-in freezers, ILR, and deep freezers. Coming on to the passive cooling method, here we are having cold boxes and vaccine carriers and ice packs. So coming on to the monitoring method, to maintain the viability, we need some monitoring equipment like stem thermometer, dial thermometer, and vaccine vial monitor. With this, we can able to identify whether the vaccines are kept in correct temperature or not. Okay, yes. Coming on to the reverse cold chain, this is especially for transporting the vaccines. We are maintaining a reverse cold chain to maintain the optimum temperature for the sample to reach the lab. So that is stool sample, especially for polio surveillance. So what is this surveillance? What is the difference between the monitoring and surveillance? So monitoring is a single process where it is made. For example, a patient is having a condition we are going to monitor. So that is meant for monitoring. What is surveillance? It is a continuous process. Even though the causative organism is there, everything can be. We are having several types of surveillance. That is mainly we can say active surveillance, passive surveillance, along with sentinel surveillance. Sentinel surveillance helps us to identify the missed cases. Sir, what is this active surveillance? active surveillance will help us. Like we are going to field visits and we are identifying the cases. Any reports of new fever or any other sort of outbreak, we are getting data from the field. That is active surveillance. What is about this passive surveillance? We are getting the data from primary health centers, hospitals. Like COVID we have done, right? In the hospitals we'll be having positive cases and it will be reported to the health department. Like that. That is passive surveillance. So the word comes surveillance is we are having three types, that is active, passive and sentinel surveillance. Missed cases. Why I am stressing on this point? This is a repeated NORCET question, very important point. Okay, yes. So we are having four methods, that is active cooling method, passive cooling method, monitoring method and reverse cold chain. Here passive cooling method does not use electricity. No electricity usage. Without electricity, this method can be formulated. Okay, yes. Here comes what are the equipments at which level it is maintained. Coming on to the walk-in freezers, already I told this freezers having the optimum temperature that it can maintain below 15 degrees Celsius to minus 15 degrees Celsius. The storage is very important. Duration is of 3 months. And it is at national level, state level, regional vaccine stores. The regional vaccine stores can supply vaccine up to 4 to 5 districts. This is very important point on NORCET aspect. Okay. Coming on to the walk-in coolers, it can maintain 2 to 8 degree optimum temperature. That is for 1 month. It is also in national level, state level and regional level vaccine stores. When we talk about this all vaccine, like till we can say small ILRs, we are having equipment monitoring. Daily chart, it is maintained. The healthcare provider, which they are posted there, they have to maintain this chart, daily chart checklist to be maintained, how much temperature is marked, and day wise everything to be marked, and monthly analysis also to be made. Okay, is there any problem with the equipment, power supply? Is there any damage towards the freezers? Everything to be monitored. That is also one of the responsibility of the nurses, especially in the community aspect. Coming on to the large deep freezers, it also has the temperature like minus 15 degree to minus 25. The maximum storage duration is 1 month, district level. Coming on to the large ILR, it is 2 to 8 degree Celsius for 1 month and district level. Here we are having large ILR and small ILR. What is this ILR? Ice line refrigerator. So what is this ice line refrigerator? Can anyone say ice line refrigerator can be seen in our ice cream shops, cafes, everywhere, right? Thus, that is called as ice line refrigerator. What is the mechanism behind this? Can anyone say if the power cut off, especially in ice line refrigerator, which are kept at primary health center level, district level and primary health center level, if there is a power shortage, how much viability that it can maintain the temperature of vaccine till how many days? Can anyone say? Yes. This is also one of the important question, which is not asked in NORCET, but it is an important question. Yes. Up to 48 hours, 1 day. Yes, come on. 1 day. Yes, yes. Yes. It can maintain up to 4 to 5 days. Maximum we can say 5 days. This is your answer. If they are asking about specifically the interval 4 to 5 days, specific day they are asking, that is with 5 days. Maximum up to 5 days we can keep. Okay, the vaccine potency can be maintained. That optimal temperature it can maintain up to 5 days. Yes. Coming on to the small deep freezers that I told, it is minus 15 to minus 25 degree and small ILR 2 to 8 degrees Celsius, 1 month and primary health center level. Now, people can ask the question, sir, some vaccines need below 2 degrees Celsius. How OPV can be maintained? So that we will be discussing that part, but it can be kept up to 6 months in 2 to 8 degrees Celsius in in the lower section of the ILR. That is one point. Coming on to the vaccine carriers, ice packs are used. Usually, the important point that is, it can carry up to 16 to 20 vials per trip and at subcenter level. And the optimum duration, storage duration is 48 to 72 hours. Day carriers, 2 ice packs are used. And it is always a water-based, silicone-based also can be used. Mostly it is water-based. Like ice packs can be used few hours, that is a short trip can be used, and subcenter level it can carry 6 to 8 vials. Very important point, that is you have to note your points. Cold boxes, like it can use 2 to 8 degrees Celsius, 1 to 3 hours, used in vaccine transportation to peripheral centers. That is cold boxes. Always you will be having a confusion between these three. Vaccine, sir, I don't know what is vaccine carriers. While in exam, I was confused. Okay, for that, vaccine carriers used ice packs, and day carriers will use only 2 ice packs, and cold boxes, especially to peripheral centers, short trip they are using, that is for 1 to 3 hours. Minimal is cold box. Day carrier, already they have given, it's a day carrier. Minimal vaccine can be taken, that is 6 to 8 vials only. Coming on to the vaccine carriers, it is a large proportion when compared with day carriers. It can use up to 16 to 20 vials per trip. Is it clear? Okay. Coming on to the vaccine storage here. Here, BCG vaccine storage, oral polio vaccine, which is the heat sensitive vaccine, which is very heat sensitive vaccine. The optimum storage temperature, that is 15 to 25 degrees Celsius, that I told. Coming on to the where it can be stored, deep freezer and walk-in freezers. But it is stored in primary health centers also. It can store up to 3 months. OPV can be stored up to 3 months. Unopened vials can be stored up to 3 months in 2 to 8 degrees Celsius. That is to deep freezer in the 4th compartment of ILR. Deep freeze stable requires deep freezing. Yes, it is a freeze stable vaccine. So we have to, what does it mean? It is heat sensitive. Okay, yes. BCG, Bacillus calmette-guerin, yes, before reconstitution. Once we are ready for the vaccination, that we are naming it as reconstitution here. What's the optimum temperature? 2 to 8 degrees Celsius. Okay, it can be stored in ILR, walk-in coolers and cold boxes. Why we are protecting it from light? Because it is a light sensitive vaccine. The 2 vaccines which are light sensitive, that is BCG and measles. Okay, after reconstitution, use immediately. Maximum hours we can use after reconstitution, that is 4 to 6 hours. Okay, yes. BCG before reconstitution 2 to 8 degrees Celsius. After reconstitution is also 2 to 8 degrees Celsius. Use immediately after reconstitution. Maximum time 4 to 6 hours. But 6 hours will be your answer, because they will be asking not interval time. They will be asking specific time. Yes, that is 6 hours. What about this measles vaccine? It is also 2 to 8 degrees Celsius. Hepatitis B, 2 to 8 degrees Celsius. And pentavalent, 2 to 8 degrees Celsius. DPT, 2 to 8 degrees, the same thing. It can be stored all in ILR, cold boxes and vaccine carriers. Same here, same. And the important thing is, measles here, it is light sensitive. Discard after 6 hours. There is a point called measles and rubella. Some guidelines, the manufacturers are telling that we can use after reconstitution till 8 hours. But as per Indian guidelines, we have to use for 6 hours only. Okay, don't confuse between that, because when you Google it, it will show 8 hours. But it is not, it is 6 hours as per the recent updates. Okay, yes. Before that, BCG was like it is 4 to 6 hours. Now they have standardized to 6 hours. So that I have highlighted here 6 hours. Please be clear in these concepts. Okay. Do not freeze the vaccine, because it is a freeze sensitive vaccine. Hepatitis B is the most freeze sensitive vaccine. Most freeze sensitive vaccine. Coming on to the pentavalent vaccine, 2 to 8 degree, and it is a freeze sensitive vaccine. Do not store in deep freezer. For that, which test we are going to do? That is shake test. Okay, freeze sensitivity identification, that is freeze test. DPT vaccine 2 to 8 degree, it is also a freeze sensitive vaccine. Okay, yes. Coming on to the tetanus, again it is stored in ILR as we discussed in cold boxes and vaccine carriers. The same thing, it is also the type of storage. It is also freeze sensitive vaccine, rotavirus vaccine. It is also liquid form, protect from freezing. It is also freeze sensitive vaccine. Pneumococcal conjugate, freeze sensitive vaccine, same ILR vaccine carriers everywhere. And Japanese encephalitis, nowadays it is also included in Mission Indradhanush, intensified Mission Indradhanush under Universal Immunization Program. Now, which Mission Indradhanush is happening, that we will discuss. It is 5.0. Detailed we will be discussing. Coming on to the vitamin A syrup, it also requires 2 to 8 degrees Celsius and it is stored in ILR, protect from light. It is not a vaccine, it is our category of syrup. Okay, yes. So coming on to the next point, vaccine storage in ILR. What is the optimum temperature? 2 to 8 degrees Celsius. Coolest zone is bottom of ILR. That's what I told. We have to keep the OPV vaccine at the bottom. This is the OPV storage area. They will be asking, they will be giving an arrow mark and they will be asking which area the vaccine can be stored. In this area, which vaccine is stored. Like that they will ask, so that please keep a note on this. First, always for maintaining to give reconstitution, we will be mixing the vaccine with diluents. So diluents will be the superficial. The topmost thing will be dealing with diluents. Below that, we are keeping hepatitis B because it is a which vaccine it is a? It is an heat sensitive or freeze sensitive vaccine. Hepatitis B is freeze sensitive or heat sensitive? Yes, come on. Am I too fast? Yes, it is a freeze sensitive vaccine. So that we are keeping at top. So below that pentavalent comes, then DPT, TT, BCG, measles, then OPV. So mostly they will put questions on this top two layers and the bottom layers. Okay. OPV, it is an heat sensitive vaccine. So we are going to keep the vaccine at bottom. Okay. Is it clear? Yes. Heat sensitive versus pre-sensitivity of the vaccine. Mostly the question comes. Most important point, most important area where the question comes in the your NORCET. So top is always from the top of the storage. First, free sensitive vaccine comes with hepatitis B, pentavalent, and pneumococcal vaccine. Okay. Then its sensitive vaccine. Here comes first is OPV, measles, and BCG. So which vaccine is having both heat and freeze sensitive? Yes, which vaccine? Come on. It's fast. We are running out of time. BCG. Okay. Yes. Some more answers. Yes. IPV. Here, high PV, we can name it as injectable or inactivated polio vaccine. That is the only vaccine which is having both heat and freeze sensitivity. Okay, IPV. When we talk about IPV, why OPV? IPV is mostly preferred for immunocompromised patients, mostly immunocompromised children we are going to give. OPV is now we have changed to bivalent. Okay, bivalent vaccine we are using that will cover OPV 1 and 3. But this IPV is effective against all three types of vaccine. Okay, all three types of polio, sorry. All three types of polio, that is OPV type 1, sorry, polio type 1, 2 and 3. Yes? Okay. Shall we move on to the next? Okay. Vaccine vial monitor. This is also one of the repeated question. Repeated question. Mostly people will confuse here, because they won't give this box. It will be like empty. It will be like fully covered, fully opaque they will give. so that students will think that, okay, it can be used. But always remember, if the inner circle is like plain or white or little fade, you can use. If it is darker and most darker, then you should not use this vaccine. What is the purpose is very important. It is to identify heat sensitive vaccine. Heat sensitive vaccine. Then it contains heat sensitive chemicals so that heat sensitivity can be done. Okay. Yes. Placement on the body of the vial, not on the cap. Can you tell example that is heat sensitive vaccine for which is mostly used? Yes, OPV. Yes, good, good, good. Anjali. Yes, good, good, good. Those who answered correctly, yes, I am happy that you are on the track. We are on the track, right? Yes. Coming on to the open vial policy. Here, a lot of updates has been done. So we will be discussing that also. The guideline says, as per the guidelines, certain vaccines can be used up to 4 weeks, that is of up to 28 days. The permitted duration is for only 28 days, only for eligible vaccine. And the storage condition, it should be properly sealed, labeled. We have to label with the date, opening of the date and time is very important, because you are the one, the nurses are going to administer the vaccine, who are the person that you are going to secure it properly and you are going to store. Yes. Placement of VV, that is vaccine vial monitor, on the body of the vial, not on the cap or neck. Very, very important point. Very important point. You may think it is a simple point, but it will give you 1 mark. Definitely. Yes. You should place the vaccine vial monitor on the body of the vial, not on the cap. Okay. Yes. Next slide. Yes. Vaccine covered under open vial policy. Allowed, that is hepatitis B, pentavalent, along with DPT also, diphtheria, pertussis, tetanus, TT, that is tetanus toxoid, pneumococcal vaccine, IPV. Rotavirus, now as per mission Indradhanush, along with 5.0, we can say, it was formulated in 2023. Till now, we are following that only. OPV, that is rotavirus, is now involved in open vial policy. Okay. Now rotavirus is involved as per Indian guidelines. Okay. Previously, it was not, but current update is OPV, rotavirus is involved. Why I am stressing on rotavirus? In your NORCET 9, 3 questions came, including prelims and mains. 3 questions came, that is of direct question from rotavirus, gastroenteritis and oral route of administration, and how many drops you are going to put. It's a direct question. Vaccine not covered, that is, first we can say measles, that I told, in India it is 6 hours only. Okay. Then BCG 4 to 6 hours. COVID, that is our Covishield and Covaxin, 6 to 8 hours, depends on the brands and instruction. You all been vaccinated, right? They will be using the open vial policy only. Hope you have done sentinel surveillance also, and we'll be dealing with the vaccine drive. So I have done this vaccine drive, so I know we are using this open vial policy only. Japanese encephalitis, single session use only, discard after the session. Yes. So that COVID-19 vaccine, especially this Covaxin and Covishield, are not used. Only single vial will be using, right? Only single vial, and we'll be administering the vaccine. So it is not covered in open vial policy. So coming on to the shake test. Here we'll be having a control vial and test vial will be having. So that control vial will not have any sedimentation rate. Okay. This is the test vial. So it is also that we can use this vaccine. Once the aluminum salt precipitation is found in your bottom of the vial, then you should not use the vaccine. This is the ultimate thing. They will be asking with the image. Till now, very important point. It is asked 1 or 2 times, but I am expecting this type of question can come. So they will be asking a descriptive manner where freeze damage vial will be having clear liquid, white precipitate, settled. Undamaged vial, cloudy form, white suspension. So they will be playing with the words. They will be playing with the tricky words in your question paper. Like they will be having, so okay, cloudy form is there. So SAT told not to use vaccine. No. If the word comes precipitation, like anything they have put in the bottom, there is an YT thing will be there. Okay, if there are any words, such words are there, then it is meant that, okay, it is having positive shake test, so we should not use the vaccine. Okay, yes. Shall we move on to the next one? Yes. First preferred sequence of vaccine administration. Always we'll be starting with oral. Okay, then we are dealing with intradermal. Then I am proceeding with subcutaneous. Then obviously next IM comes. What is the fifth route of administration? Here comes the point, pentavalent. Always at last I am going to give this pentavalent. First is oral, intradermal, subcutaneous, IM, and pentavalent. They will be giving the sequence and they will be asking you to reorder it. Okay, so that first is oral, intradermal, subcutaneous, IM, and pentavalent. Is it clear? Okay. So first point, Edward Jenner. Edward Jenner coined the term called vaccination. He is the father of vaccinology. Louis Pasteur, who coined the term vaccine. Okay, and he is the person who developed vaccine against this cholera also. Okay, yes. So mission Indradhanush 5.0. Till now, we are following this mission, intensified mission Indradhanush 5.0. When it was started in 2014. Okay, during my second year, I was posted in the vaccination drive under mission Indradhanush. Okay, yes. The major concept behind intensified mission Indradhanush to find out the unvaccinated children and keeping them vaccinated. Okay. Now, what are the updates? Vaccine, that is rotavirus, is under open vial policy. Third dose of fractional IPV now being introduced, that is of total 3 doses. And Japanese encephalitis is a killed vaccine we are using now. And diseases covered, that is total. Japanese encephalitis only in the endemic areas we are going to give, not in all areas. So we have marked as a star in our immunization schedule. So when we talk about this fractional IPV, the total dose is of 0.5 ml. But if we are giving as fractional dose, that is 1/6 vaccine, 0.1 ml intradermal, we are going to give, that is of fractional IPV. Okay, is it clear? Okay. So you all know about this vaccination schedule. A quick recap. First, we are going to give PCG at birth. We are going to give at birth. Hepatitis dose also at birth. OPV at birth. Here we are going to give 6, 10, and 14. Rotavirus vaccine, when we are going to give? Yes, anyone can tell? Again, the same thing, 6, 10, and 14. Okay. Yes. Dosage, BCG is 0.05 ml. We are going to give. And if it is more than 1 month, I am going to give 0.1 ml intradermal left upper arm. Okay, this is intradermal. What about after 1 year? After 1 year of 5 years, for immunocompromised individuals, if I am going to give BCG, Montex test to be performed. Montex test to be performed. For BCG administration after 5 years. Okay, after 5 years. Okay, please make note of this. Okay, the dosage is 0.5 ml and OPV is 2 drops. Here OPV is 2 drops. That is oral. You all know about this. Rotavirus is also 5 drops oral. It is against gastroenteritis, especially in children. The peak of age for rotavirus that it can attack the infants, that is of 2 years. Okay, pre-toddler, we can say toddler, that is infancy till toddler. 0 to 2 years is the important thing. Okay, yes. Coming on to the inactivated poliovirus, we can give at 6 and, can anyone tell? IPV, 2 fractional dose we are giving at 6 and 14 weeks. Pentavalent, when it can be given 6, 10, and 14. Measles first dose 9 months completed, that is 9 to 12 months we can give one. And Japanese encephalitis first dose 9 completed months. Coming on to the vitamin A, first we are giving at 9, that is of 1 lakh international unit. Yes, oral route. It is subcutaneous. Okay. What about measles? First we are giving a subcutaneous. Pentavalent, you all know about where it can be given, IM. This is inactivated. That is, if it is fractional, we are giving it as intradermal only, right upper arm. Okay, yes. So DPT booster is come on fast. DPT 16 to 24 months. We are giving it 7 years and 0.5 ml, and no diluents are used. But diluents I forgot to discuss. Yes, BCG we are giving with sodium chloride, and no diluents are used for other vaccines. Here, measles we are using sterile water, and Japanese encephalitis we are using phosphate buffer. Okay, yes. This information will not be available in our immunization schedule, which is provided in our website. Like which website you can take, that is National Health Mission. You can go and search the recent updated thing. It will not be mentioned. So this is an additional information for you. Okay, yes. Japanese encephalitis, again phosphate buffer, measles, sterile water. Here, measles second dose 16 to 24 months. OPV booster, again 16 to 24 months. Japanese encephalitis second dose, when we are going to give, that is same 16 to 24 months. DPT booster dose 2 at 5 to 6 years. What about TT? We can give 10 years and 16 years. 0.5 ml. When talking about this vitamin A, from second to 9th dose, we are going to give till 5 years per, we can give 2 ml. Okay, 2 ml, that is 2 lakh international. 1 ml is equal to 1 lakh international unit. 2 ml equal to 2 lakh international unit. Okay, this is one important update. Coming on to the pregnancy, if the woman is pregnant, at the early pregnancy, we have to give tetanus 1 and tetanus shot 2. There should be 4 weeks of gap. That is of minimum 28 days. 0.5 ml intramuscular, we are going to give upper arm. TT booster, if there any need of vaccine, like in the past, within the past 3 years, then we can give 0, that is 5 ml, 0.5 ml intramuscular in the upper arm. This is the update. Okay, yes. Is it clear? We have rushed up like anything, but we are having time constraints. We have done the session. Is there anything else you want to discuss? Shall we go on to the question sessions? Is this possible? You are having any doubts?
Sir, I think we'll ask them to put the questions in the Q&A box, and then we'll take them in the Q&A round.
Yeah, that's great.
Okay. Thank you so much, sir. Thank you so much for sharing this topic in and explaining it in such an easy way. So thank you so much. Now we will be moving to our next segment. I would like to request you to stop sharing your screen so that I can move forward while sharing my screen. So I hope you all are able to share, see my screen. So now that we have heard from our expert speakers, it's time to shift your focus to the next segment in the today's session. In this segment, we'll walk you through the NORCET Rapido Crash Course, a clear structured roadmap designed to help you plan for your NORCET 10 preparation effectively, especially in the final phase. A small tip for everyone, pay close attention to this session because the questions that you'll be asked will be based on this topic here. And yes, this is also where you stand the chance to win the special rewards. So stay alert, stay focused, and get ready to make the most of NORCET Rapido Crash Course. So as you can see, the NORCET Rapido Crash Course is planned for NORCET 10 and it's specifically in English. Here you will be getting 300 plus hours of live premier classes, and you will also be getting the conceptual revision with the 100 plus hours of 15 subjects and through the 5,000 plus high yield one-liners from Masterstroke Volume 3. And the conceptual practice, as you know, it is very important to practice questions for NORCET. You will be practicing the questions through 6,000 plus MCQ through the Strike 2.0, where you will get different types of tests, such as subject assessment tests, mini tests, grant tests, image-based tests, clinical scenarios, recall papers, national pre-NORCET test, and a special NORCET rapido special test, which will be based on the Strike Q band. Then for your conceptual learning, we are also giving you the study material in which you'll be getting the Strike Q bank, where you can practice all your questions, and it has an excellent strike rate in NORCET 9. You will also be getting a Masterstroke Volume 3, which is 5,000 plus 5 high yield one-liners based on the analysis from NORCET 1 to 9. And all the revision sessions are aligned with this book. And again, we are also going to give you a last minute preparation strategies, which is our prediction series, and we will cover all the hot topics with very high probability of appearing in the exam, and this is like a must attend before the exam. We are also going to cover test and discussion session, where there will be 150 plus hours of detailed test discussion video based on the NORCET rapido test, and it will cover most frequently repeated tests. You will also be getting doubt clearance sessions from doubts for all your doubts and for making you confident for the exam. Okay, now I will share our pedagogy here. So as you can see, once you enroll in this course, you will be getting an orientation session through your batch mentor. There will be live premier classes, 4 hours of live premier classes, and there will be assessment test after every subject's conceptual revision. There will be test and discussion. So after every subject-wise assessment test, there will be a test on the same subject. And then you will also be getting the Strike Test 2.0 for all the tests and all the practices. And then we will also be giving you the doubt session. What more are we giving you is the 90-day strategies for NORCET 10, how to reduce the negative marking. Then also there will be progress review and reflection session. There will be faculty interactions and Q&A master classes. There will be a session on how to build conceptual clarity and recall power. And then you will also be getting a session on understanding what is NORCET, how the pattern is, what is the blueprint and trends. So I hope this Rapido crash course is important and beneficial for you guys, and you are able to understand this. So now we are going to move to the next slide. So this is our Margdarshan by Margdarshak session. NNL1 supports students not only for university exam, but also provides strong mentorship for NORCET preparation. We regularly conduct our Margdarshan by Margdarshan session, where toppers and experts guide smart, effective, and exam-oriented strategies. These sessions are exclusive for our NNL paid subscribers. If you want a structured guidance and mentorship, you can enroll in our courses. As you can see, all our rank holders from all the NORCETs that you can see and how many sessions they have done, the student interactions and their ratings. You can also see a few glimpses and feedbacks and testimonials here. Now I am taking you through our 1,000 plus selections, our proud rank holders in the NORCET 9. And then you can also see our 7,500 plus selections for 5 consecutive years from 2020 to 2025. And you can see that we are constantly getting the ranks in the top 10 of the NORCET. Okay, so now we are going to move to the Q&A round. So the process of Q&A would be that participant can add their questions in the Q&A box. The speaker will be addressing them one by one. And if any questions are remaining at the end of the session, this may be posted in the YouTube comments once the video is uploaded, where they will be addressed directly. So I would request you all to start putting your questions so that I can take them. Please feel free to put questions. Okay, let me see if there are any questions.
Yes, Arushi, I just want to give an update regarding BCG vaccination. Shall I? Yes.
Yes, please.
Yes, BCG vaccine maturation they have asked. That is 2 to 3 weeks. If the 2 to 3 weeks is the ideal time, that is the papule formation. And 3 to 4 weeks will be having small ulcer. It will be developing as a small ulcer. Then if we talk about the maturation, 6 to 8 weeks, this is always a controversial thing. 6 to 8 weeks, or it will be 8 to 10 weeks. So ideally the recent update says that it will be like 6 to 10 weeks, the BCG scar formation. So ideally you should click the maximum up to 10 weeks, we can choose the option. So it is always a controversial thing. This is also an NORCET 9 question, where the ideal time is 8 to 10 weeks. Ideal time we can say 8 to 10 weeks. That is the scar formation for BCG vaccination. Yes. If there are any doubts regarding this vaccination, you can ask me so that I can clarify your doubts. Yes.
Feel free to drop in your questions. Okay, let me check. Okay, we are getting good comments. I hope, like, if there is any questions, we'll be happy to take one. Okay, okay, one question is, sir, can you share the importance of the shake test?
So shake test, it is to identify the free sensitive vaccine. Okay, the if the vaccine ideal temperature is 2 to 8 degrees Celsius, if the vaccine is showed storage is beyond like less than 2 degree, like it is gone beyond that is minus degree or 0 degree, then for to maintain the potency, if the vaccine is potent to administer or not, whether it is having a life or not, that we are going to check, that is shake test. The important this is we are having a control vial and test vial. Control vial where we'll be having a normal thing. In test vial, we are going to shake that, not vigorous shake, 5 to 6 shake we can do, and not vigorous shake we should not do. Then if there is a sedimentation below that, in the bottom, if you see like aluminum salt precipitate is there, then we should not use the vaccine. Then the potency of the vaccine is lost. If the there is a cloudiness is there, like the suspension of cloudiness is there, then we can use the vaccine. That is the importance of shake test. Okay, yes. The important point you
Sir,
should know. Yes, yes. Come on.
okay, thank you, sir. I think I'll take
Yes.
one more question. That is, here is any trick to learn vaccination in an easy way?
What trick you want? The immunization schedule is already in the website. You have to just go through it. So the easy trick which I can say you can take a printout of the vaccination schedule, keep it in your room. Daily you have to go through it. I will give you the trick that weekly that is 7 days challenge we can keep. Daily you have to keep learning that vaccination. 7th day you have to recall on yourself without seeing the image which you have pasted. So if you are following that 3 weeks continuously, then obviously in 4th week you will remember without learning anything. So this is the easy way, because vaccination needs updation and it is a very tricky concept while you are attending in your MCQ, like in your NORCET exam, in your how to say very anxious situation, it will be get confused. I hope I also confused in a lot of situations. So this is how I learned, I remembered.
Great, sir. Thank you so much. I think
Yes.
with this, now we'll be moving to our next session.
Yes.
So now it's time for the special reward that you all have been waiting. Please scan this QR code and attempt the quiz based on today's session. The top 10 participants who answer all the questions correctly and have the NNL app downloaded will receive this Masterstroke Volume 3 from Nursing Next Live. The QR code will be active for 24 hours only. So participants must download the NNL1 app to be eligible to participate in this quiz. So I'll just give you a minute to scan the QR code. Feel free to take screenshots, or like you can directly scan it here and give your answer. So top 10 winners with the right answer, plus with if they have the NNL1 app downloaded in their phone, then you'll be able to be eligible for this reward. So I'm just gonna wait 1 minute and then we'll be continuing with the session. So I think there's a question, how will we know if we get the rewards? So once we get all your answers, everything, we get it analyzed, who all are our top 10 winners. And based on that, we then send it to our teams and then the rewards get dispatched and you'll be informed accordingly. Okay, I think everybody has done like they have scanned the QR code, and now I'll be moving to our next segment. So this is the winner of our last Udaan Webinar Series. As you can see, we have winners from different colleges who have joined us in the webinar, participated, gave the right answer, and also had the NNL1 app downloaded. So these are the winners from our last webinars. So now with this, we conclude today's Udaan session. A heartfelt thank you to our speaker, Mr. Mutthukumaran sir and Mr. Dominic Maximillion, and to all the participants who joined us and made this session truly meaningful. The aim of Udaan is to empower students, inspire learning, and give wings to every nursing aspirant. We hope today's session had added some clarity for your university as well as NORCET preparation. We invite you to download the NNL1 app, now available both on Android and iOS. We are excited to share that the NNL1 2026 comes with many new features for enhanced learning experience, designed specifically for nursing aspirants. Do follow us on our social media platforms for regular updates, learning resources, and upcoming sessions. Keep learning, keep growing, and keep flying high with Udaan by the student for the student. Thank you and have a wonderful day ahead.